Can an AI assistant help you dispense medications, answer your queries, and counsel patients? Guess what? It's already happening and it's reshaping pharmacy. But however, there are some soft skills that cannot be replaced by AI, such as emotional intelligence, ethical decision making, patient counseling, effective communication, clinical judgment. So today's video is going to be how to counsel patients, how to build that confidence in patient counseling. So let's get started. Welcome to my YouTube channel. Patient counseling is giving information, advice, and support to help them take their medicines correctly so that they stay on treatment, and this will help them to improve their health and quality of life. So, what are the essential counseling points that you should cover? So, number one is patient identity. Ensure that correct patient before counseling. So, this is where a lot of medical errors happen. So, ask what's the name of the patient as per our international patient safety goal, which is goal number one, to identify the patient correctly. Next, introduce yourself and set the purpose. So this will really help in building trust and explain the reason of this counseling session. So you can just formally greet them, hi, hello. So I just want to explain how to take your medicine safely and correctly. So this way you can start the introduction, and if you want you can introduce yourself also. Next, verify the understanding. So this should be a personalized counseling session and avoid repetition. Ask the patient like do they know how to take these medicines? Like do you know how to take these medicines? Have you taken these medicines before? Just to assess their knowledge and also just to understand what the doctor has instructed them to do so. Next, you will be covering the important points like the name of the medication, inform what the drug is, whether it's a magnesium supplement or whether it's a medication which is used to reduce the blood cholesterol levels, etc. In such a way, try to inform the patient what is the medication. Next, the indication, why it is used. So help patient understand the purpose of the medication, like if it's a medication, if it's an antibiotic, why it's prescribed, if it is an anti-allergic drug, why it's prescribed. So you can also ask them what are their symptoms, or you can cross-check the diagnosis too. Next, dosage and frequency is very important, especially in special populations like pediatrics, geriatrics, CKD, renal impairment patients. So in such cases, pregnant patients also. So such cases, make sure whatever the dose doctor has written is correct and accurate and it is suitable for the patient, just to prevent under and overdosing. Then most importantly, the administration of the medication, how to take, which time of the day. So basically this is to maximize the effectiveness as well as to reduce side effects. So you can also inform them how take a medicine, take it with the food, especially some antibiotics has to be taken with food to reduce stomach upset, some antibiotics 1 hour before food. So explain how this medicine has to be taken clearly. Also explain the duration of use, just to avoid premature stopping or overuse of this medication. So I have patients who asked me as everything in UAE is based on insurance approvals, so they might approve the more quantity of antibiotics than required. So sometimes this is really dangerous. So sometimes what happens is, I had a patient who asked me, can I keep this medication since I'm having extra tablets? Can I keep this as a reserve? When next time if I get the same infection, can I use this? So this is the problem. The general population still thinks in this way because we are not properly counseling the patient that this is only a one-time course. So once the course is completed, just discard the antibiotics. So this is how you have to instruct the patient and why it is prescribed. So also tell them to complete the course of antibiotics. Now, common side effects, prepare the patient to reduce fear, especially for tuberculosis medications. Anti-TB drugs like rifampicin can cause reddish urine. Antibiotics like nitrofurantoin, vitamin B complex tablets would create more yellowish urine. So you can just inform the patient about this. And certain antibiotics can cause diarrhea, loose stools, bloating, stomach upset, such symptoms. So these are usually mild and temporary. So just prepare the patient and just inform them if you know some of the side effects. Now, also very important point is to what to do if a dose is missed. So this really helps. This information helps the patient to minimize mistakes, like just to prevent the double dosing. So make sure you inform this correctly, and you can also give warnings and precautions. Especially there are some patients who take alcohol, laxatives, antacids. So make sure there are no drug interactions between them. And if they're taking multivitamins, make sure there is a proper gapping between these supplements like iron, calcium, magnesium. Next point to explain is the storage instructions. So some medications has to be stored in refrigerator, especially pre-filled syringes, pens like Monjaro, Ozempic, some eye drops, probiotic supplements are there which has to be stored in refrigerator. Some creams are there. So based on the medication, explain the storage instruction. And usually all medications are supposed to be kept in cool, dry place. The ones which doesn't have a special instruction, mostly it will be stored below 30 degrees Celsius. So it's better to keep it in a cool, dry place, away from moisture and away from sunlight. Then talk about drug-food interactions. If you see our harmful combinations or medications which cause drug interactions in the prescription. And next important thing is to encourage questions from the patient. Promote a two-way communication rather than you speaking a lot. So suppose like if you're unsure about anything in the prescription, like the timing or mixing it with other medications, just you can inform the patient to feel free to ask if they're having any questions. Just promote questions from the patient, and also you can ask them regarding what doctor had advised them, just to prevent the mismatch of information or contradictory statements. And confirm the understanding. Ask patient to repeat key points. You can ask something which you have already explained to the patient, just to know, ensure the patient comprehension. So ask just one or two questions to just save time. So this should be an ideal patient counseling session. Make sure all these points are covered in a patient counseling session. Next is how to build confidence in patient counseling and communication skills. Number one, you have to have that basic knowledge. So only if you have that knowledge, you will naturally build the confidence to explain about a medication. So be sure what you're talking about before facing the patient. Make sure you think it all out about this. If you see a medication, everything should come into your mind about this medication. So if you're a beginner, you can prepare your counseling cheat sheets like for common medications that you encounter in a pharmacy. So basically it will cover the indication, side effect, and some common counseling points. And you can even use apps like Lexicom, Medscape, Drugs.com for a quick, reliable information. And practice explaining in simple language. This is very important. Avoid using medical jargons and use patient-friendly terms which a normal person in front of you can understand. Pick one drug daily. So this is like an assignment for you, or it's just a practice session for you. Pick one drug daily. Explain it out loud as if you're talking to a patient. Record yourself and listen. Check for the clarity, tone, and confidence. Then improve your listening and empathy. This is very important regarding patient counseling, because patients, they are already very tired, they are sick, and sometimes they are very angry, especially when insurance approvals take time, especially if they just want to go somewhere just to grab the medicine and they just want to get out. So they might be in a mixed emotions there. So we have to improve our listening and empathy. No matter, we know what the patient is going to say. They might be angry, they might be shouting, it's fine. So make patients feel heard and understood. So during patient interactions, pause and listen actively without interrupting. And even if they're shouting, we have to be quiet, because here we have to use our emotional intelligence. Just be calm and quiet. So you can just nod along with them. Just say, I understand. Yeah, okay, I'm here. I'm listening. Just improve your listening and empathy rather than interrupting and arguing, because it's just a waste of time. After all, they all are patients. They all are helpless, and they just want their medications. Then if you also, you can practice your communication skills and patient counseling sessions with your friends or colleagues by taking turns as patient and pharmacist. This is really a fun way to practice. So you can start small, begin by counseling on simple topics, and then move to more complex one using devices, insulin, inhalers, etc. So this will build confidence gradually. Then you can use visual aids to explain. This makes it easier and more effective. You can show leaflets, diagrams, any pictures which will help the patient to understand. If you're so creative, you can even create your own counseling cards with pictures if possible. And once you practice this, you can ask feedback, know what you're doing well and where to improve. You can watch and learn from others, observe senior pharmacists or doctors around you, watch counseling videos on YouTube. There are plenty of them. So go through all this. This all is going to help you in improving your communication skills as well as patient counseling skills. So work on your soft skills daily. Become naturally better at conversation. So practice small talk with strangers, or you can use apps like Elevate, Speechify, YouTube speaking channels to train your voice, tone, and clarity. So I'm going to share a free counseling cheat sheet for an antibiotic here. So you can get that link below the description of this video so that you can get an idea on how to prepare these for other drugs as well. Emotional intelligence or emotional quotient, it's a huge role in patient counseling. Often this is what separates from a good pharmacist from a truly impactful one. So my next video is going to be about emotional intelligence or emotional quotient, which is one of the important skill a pharmacist should have. So I hope this video was informative for everyone watching this. If you found it informative, please share it with your friends. So that's all, you guys. Thanks for watching. Have a nice day ahead.